Let's do that.
Shall we call the meeting to order?
We shall.
All right. Roll call, please, Andrea.
Director Perezio, Director Shore,
Yes.
Director Delara, Director Loxton,
Present.
Secretary Barraza. Here. Vice President Rodriguez, President Rogers.
Here. Please join me with pledge of allegiance. We begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this time, may I have approval of the agenda? So moved.
Second.
All in favor, please say aye.
Aye.
Now we have public comment. At this time, comments from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. Our policy is limiting speakers to no more than 3 minutes, and we cannot take any action on anything brought up. Andrea, are there any public comments online?
There are no public comments.
Are there any public comments?
No public comment.
Thank you. Our consent agenda, we have 3 items on the consent agenda. Did anybody want to pull them for discussion?
I do want to pull item number 3, as I will be recusing myself from that discussion.
Okay, we can do that.
That's 3A and 3B as well. Is that 3A and 3B?
Yeah.
So I'll move approval of the other items.
So moved.
Second.
Thank you. Roll call, please.
Director Shore,
Yes.
Director Loxton,
Yes.
Secretary Barraza,
Yes.
and President Rogers.
Yes.
And me too?
I'm sorry, Director Delara.
Yes.
All right. Item F, strategic grant funding. The staff want to introduce that for us?
Wait a minute, she pulled that item, but they need to vote on all the other items.
Got to vote on item 3.
Oh, I see.
Without levy.
I see. I move for approval. I'll second. Roll call, please.
Director Shore,
Yes.
Director Loxton,
Yes.
Secretary Barraza,
Yes.
and President Rogers.
Yes. Item F, strategic
Yeah, we're done, right?
Mhm.
Yeah.
Thank you.
Ronaldo J. Carrion, MD Foundation. Grant 1496. Staff, start, any comment?
No, it's all covered in the staff report. It covers scholarships for students that are pursuing a career in healthcare.
Mr. Tago, did you want to make any comments about the grant?
No, the only thing that I want to say is that support like this is vital for our organization. We've been in a growth mode for the last 5 to 7 years, and it's because of support from people like you that we're able to help more and more people. And the good news is that most of those people that we're helping come back to the Coachella Valley. Most of them graduate college in 4 or 5 years. And so we just hope that the trend continues, and thank you for your involvement in it.
Is there any public comment?
No public comment.
Any public comment from the person here? I'll entertain a vote. Any comment from the directors? Go ahead.
I'll make a comment in that I am very supportive of this grant. I had an opportunity as several board members that we attended the One Future event on Friday night, and to see so many students coming back that are now doctors, that are now in the healthcare profession, I'm just really, grateful that we have organizations like this that are making a difference to really increase the number of local people that can make a difference to improve the shortage that we have. So thank you for doing this. And I really like the fact that you're focusing on giving scholarships to juniors and seniors because of the fact that, we know that they have more likelihood to actually, not change careers. I know you give it to younger, earlier students, but the fact that you focus a great deal more emphasis on the junior and senior, I really like that. So I move approval.
Thank you.
Thank you.
Is there a second?
Second.
Roll call, please.
Director Shore,
Yes.
Director Delara,
Yes.
Director Logston,
Yes.
Secretary Baraza,
Yes.
and President Rogers.
Yes. Okay, item G, reports. Desert Regional Medical Center CEO report. Michael DeToro.
Back up here.
Yes, please.
All right. The report is in the packet. I would like to add that I'm excited in my new role as CEO at Desert Regional. I've been at the hospital since 2018. I'm a pharmacist by background, and I started at Desert Regional as a COO, moved up to the Chief Administrative Officer, and I've really enjoyed working with Michelle, and will continue to work with Michelle in her new role where she's focusing more across DCN and in all of our campuses and what we're doing together as a market. So excited for the care that we provide for our community. Just adding to the report, we had a successful Joint Commission visit for our knee and hip replacement surgery accreditation. We had successfully matched all of our residency slots in all of our programs except for our transitional year, which is expected because a lot of those residents place post-match, and we expect that we will be successfully filling those final slots. And then I would like to add, this past weekend, we had a really wonderful event, which was a reunion for our NICU patients. It was well attended. We had over 450 people show up, including we got a lot of media coverage, and they interviewed some folks that one lady that got interviewed, her name is Sierra DeCastro. She's 29 years old. She is an alum of our NICU. She had a 10% chance to live. She was born 3 months early and just raved about the care. Was excited to see some of the caregivers that actually took care of her when she was a little one. So it was nice to see in a really nice event. Any questions?
How many residents did you actually match?
So we matched all 10 of our emergency medicine, all 8 family medicine, the 3 general surgery slots, 6 internal, and we matched 4 out of the 12 transitional year to start, and we would expect to fill the final 8.
Great, thank you.
Yep.
What's the status of the general surgery program at Desert Regional? Plans for expansion, plans for growth. Was it 3 last year? I don't know the history.
So it's a 5-year program, 3 residents each year. We're matching the 4th year.
You're matching the 4th year now.
Yep.
Okay, good.
Thank you. For reports, for my report for the governing board, it was emailed to you today, this morning. We met last Thursday. There's nothing really earth-shaking on it, except I did inform the governing board of Senate Bill 588, sponsored by Senator Ochoa. So that it had been introduced for a freestanding emergency department in the East Valley. CEO report number 3, Chris.
Thank you, President Rogers. So the first item on the list is the letter of support for Senate Bill 534 that Senator Padilla is sponsoring. It's titled Salton Sea Region Green Empowerment Zone. That letter was signed and submitted a couple of weeks ago, but it's there for the board and the public's information. If there's any questions regarding that. If not, we'll move on to item B, which is the CEO engagements and media visibility. Those items are in the packet for your review. Any questions regarding those items? If not, we'll move on to item C, which is consideration for the Board of Directors to approve a letter of support for the district CEO nomination to serve on the Association of California Healthcare Districts Board of Directors. This would be an application process that I would apply to. They have had some loss in their Board of Directors, a couple of CEOs that are no longer serving on the board. So seeking the board's approval for application for that process.
Any discussion? Any public discussion? May I have a motion to approve?
I'll move approval.
Second.
Is this a roll call vote?
I think all in favor, it's fine.
All in favor,
Aye.
please say aye.
Aye.
Opposed?
You sure you want to do this, huh?
Okay, item D.
All right, well,
That's fine. You know, you could, it's okay for you if it's unanimous, but typically we should do a roll call. Okay, for the record. Sorry.
For the record, we should do a roll call.
Yeah, there's a rule that basically says we've got to make sure that we have a record of how everyone voted. And you can't anticipate that it's always going to be unanimous.
Well,
So
shall
the
we-
easy way is just to do a roll call.
So shall we go back and do a roll call?
No, you're fine on a unanimous.
Item D, 3D.
So in your packet is some information regarding a Mobile Healthcare Association, the 21st Annual Mobile Health Clinics Conference. That's to be held in Louisville, Kentucky. And staff has been working on some information with regard to our mobile units. We feel very proud of our mobile unit program that that the district has and the board has supported. And so there are some staff members that we would like to attend that conference that we feel are important members of staff to attend. So we're looking for support from the board. The cost of the event is $600 and some odd, and then plus airfare and room expenses and such. So we're looking for the board's support on this.
Who are you suggesting go?
Would be me, Donna Craig is the Chief Program Officer, Megan Kane, who is has actually been working very strongly with Alejandro in developing the information that we're providing to the organization for that conference. We will provide that infographic information to the board. And then Alejandro and then Sergio Rodriguez, who supports the team with the mobile medical units. So it'd be those 5 staff members.
Any discussion?
Have we been in the past?
No, this would be the first time for this event.
Ready?
So my question is, you put the cost for the registration and identify that there's other costs involved, airfare and hotel. So approximately it would probably be like 3 times the cost of this.
Yeah.
And 3 or 4 times the cost for this times 5 people. And I trust you to make the decisions on administrative things. I'm just going to ask you to just confirm that all 5 people are needed to go.
Yeah, and I'd asked the same question with our management team. And it seemed to make sense then to incorporate Megan Kane as is she a program officer? Senior program officer, thank you. And Donna, if you might share your thoughts as to why it would make sense for Megan to join us on this.
Part of the reason is that she is very much involved with public health, being the senior program officer of public health. She's been working very closely with Alejandro in developing the proposal to go forward with the mobile health mapping, as well as presentation at ACHD and also at the American Public Health Association conference. Megan is shown her true talents in developing RFPs and also working very closely with strategic planning and developing initiatives. And I think as we're going into strategic planning, we have a facilitator that's going to be, it's to say, are we going to start talking about a mobile health clinic initiative where we run our own operations or whatever. So she's very instrumental in developing the data, gathering the data, and doing the research on a lot of important issues that relate to our strategic plan, especially with mobile health minutes.
Okay.
Is the intent observational or is the intent to make a presentation or both?
Both plus.
We're making a presentation about our program?
Yes.
Okay,
So there's
That's
a third
what's
component, networking.
Yeah, and networking and learning more about what other programs are doing and to be able to bring back that information to help enhance our program.
Is this planning to be part of our strategic plan? I know we haven't had a chance to sit down and we all have a lot of thoughts on strategic plans. But is this something that we see, aligned in our future? Because I think it's very much worthwhile to go do it. If it's aligned with what I think Donna said, if this is aligned with where we think we're going to go. I know we haven't done our strategic plan, but we've talked a lot about this. So I think as long
Currently,
as
it is
we
one of
agree.
our strategies and both goals.
Yeah.
Goals 2 and 3 is one, each strategy, there's strategy in each one that is developing mobile clinics, and
Correct.
supporting mobile health clinics.
Well,
Whether it
and,
be us or it be supporting other organizations.
I'm in full support because.
and I anticipate that, it'll be part of the discussion that we're doing with our strategic planning process going forward. I believe that it'll be an initiative that we will continue with. And I think that will help enhance the conversation that we have going into the strategic planning, even though this event isn't until September. I think I just wanted to be able to get support for attending this conference. As we move forward, it'll run parallel to our strategic planning process, and I think it will be influential in our discussions.
Any other comments?
Look
Any
forward to
pub-
hearing back.
Go ahead.
I said I look forward to hearing back from them.
Absolutely.
Any public comments? Anybody has their hand up?
No public comments.
Public comments from those present? Not hearing any. May I have a motion to approve?
I'll move approval.
Second. Roll call, please.
Director Shore,
yes.
Director DeLauro,
Yes.
Director Lobster,
Yes.
Secretary Barraza,
Yes.
and President Rogers.
Yes. Motion approved. Reports on item F. Consideration of $5,000 lifestyle award sponsorship for the American Heart Association.
Let's start with item E first, which is another $5,000 sponsorship to the Inland Southern California United Way for their United for Good 2025 annual gala, scheduled for May 2nd of 2025. And we did receive the budget. Apologize, I don't have that.
It's okay.
Thank you. So they do have a budget of about 100,000. I'm sorry, 146,000 of expenses with a projected net income of 100,000. And their projected attendees are 330. And so we're asking for support of the board for approving this $5,000 sponsorship.
What's Momentous contract?
They're the actual event planner.
Okay, thank you.
Any other discussion? Any comments from the public?
Public comment.
Comments from those
I
present?
do have them.
Let's go ahead, Ms. Liddy.
Now that that United Way is Inland Southern California United Way, I know that they have a greater region that they support. I would like to have a better understanding in the future. Maybe this will be a way for us to have those conversations on more specifics of what they're doing for the Coachella Valley. I know they have some contracts for like 2-on-1, but 2-on-1 has always been so poorly administered here in the Coachella Valley that maybe that's one of the ways that they're gonna improve if we can support them in this way. But I just want to know, what are they doing for the Coachella Valley? So maybe we could have those conversations at some point.
And one thing to that point too, is we recently been awarded a $200,000 grant from United Way to continue this, the work that we're doing around the COVID-19 disparity work as well. So that was kind of part of the reason that we felt that would be worthy of supporting this organization.
But thanks for reminding me. I forgot about that one. But I think it'll be good for us to know, especially the 2-on-1. I think that has the need to improve it. And I just hope that they have us on the radar as much as they do the more western part of the county.
Any more discussion? May I have a motion?
Second.
Roll call, please.
Director Shore,
Yes.
Director Delara,
Yes.
Director Logston,
Yes.
Secretary Baraza,
Yes.
and President Rogers.
Yes. Now, number F, lifestyle.
Thank you. So item F is consideration and approval for a $5,000 sponsorship for Lifestyle Awards for the American Heart Association annual Coachella Valley Heart and Stroke Walk, which is for November 17th of 2025. They have a total budget of $13,000 and estimated attendance of about 700 people.
Excellent. Discussion? Any public discussion?
No public comment.
Discussion from those present? May I, go
How many
ahead.
years have they been doing this? Does it say in there?
I don't know the answer to that, but
I've been doing it for the 22 years I've lived here.
Very good. I thought it was a long time, so thank you.
Thank you.
I think they're holding it at Cal State San Bernardino on Desert Campus this year there instead of the Civic Center Park. Different.
Any more discussion? May I have a motion, please?
I so move.
Second.
Seconded by Letty. Roll call, please.
Director Shore,
Yes.
Director Delara,
Yes.
Director Logston,
Yes.
Secretary Baraza,
Yes.
and President Rogers.
Yes.
thank you.
Number 4, legal report.
I'm going to confine my comments to closed session.
Committee meetings report. Secretary Baraza, did you want to give a report on the legislative committee?
Sure. So, hi, everyone. We got to meet a couple weeks ago. We have the draft meeting minutes on there if you have any questions. Guys have any questions about it? Okay. 1B, Bill SB 588. Was introduced with the language saying that there was going to be a feasibility study for the clinics. It's gonna be sent to the health committee. We still don't have a date for that. Once we do, we'll make sure that we have, we need to find out if it's gonna be heard during the committee, or if it's gonna be in consent agenda. If it's in consent agenda, then we might be fine. There's gonna be some advocacy work that we're gonna have to do for it. I know that we had members of our board and then Chris attend open house with Senator Padilla, and they were able to, did he actually say yes to?
He nodded it with a smile on his face, so
That's good, yeah, and we'll do some follow-up with his team
He
as
did
well.
say he would follow up.
yeah.
Okay, well,
And he said for us to stay in touch, and his, I think
Right.
his district director was standing by his side, so.
If this were to move forward, who's intended to do the work to answer the question, yes or no, and what the issues are?
You mean in terms of legislative process?
This is a request to do a feasibility study.
the state.
That's
would
my
be
question.
conducting it.
Who's going to do the feasibility study
The state
if and
would-
when it's approved?
HCI or in general, the Department of Public Health.
Yeah.
Oh, okay.
Yeah, so there's going to be a proposed budget of $1 million that would support them, and it would be,
That was part of my notes, but go ahead.
oh, I am so sorry. Forgive me. Continue on.
So typically, when there's a bill that needs funding, if you're not including the funding within the bill, you need to ask for money. In this case, it's been, the price tag for the feasibility study is of 1 million. And I suppose confirm that Senator Ochoa Bo already submitted a budget request to cover for that amount. We needed to find an official definition, right? I sent you something.
Yeah, I see you sent some language, and then Michelle Finney was also going to send us some language as well.
Good, so if this works, it'll be us, right, our group actually creating a definition for it, which will live in statute, crossing our fingers.
Yeah.
So that's the update on that. Any questions?
Just a couple comments on it. I think it's, you know, coming from the healthcare position that I'm in, I thought freestanding ERs were kind of not necessary. And then we've had some conversations at Eisenhower with the actual ER physicians, and the overall feedback from the directors and the staff there who work in a very, you know, overstaffed ER, or say understaffed and too many people coming in, they are all for engaging in this. So I think if you're looking for help around that from the healthcare community, I think there's plenty of people here in the Coachella Valley that work in healthcare in the ER that would support that bill and maybe come together and helping structure some of that.
Well, and to that point, we've been asked to provide a letter of support, which we will be developing, send out, you know, for the board to see. Maybe it's something then that we can ask our healthcare partners to, you know, provide letters of support to go along with that. So,
We do them all the time for certain legislative issues.
yeah.
And then also like, for example, the senator's office, whomever's staffing the bill, they would also be working on securing some of the support here locally and throughout the state.
Yeah, we had a member of Senator Ochoa Bo's staff attend Friday night's event. And one of the things that he suggested to me to pass on to you and staff is to find other institutional type sponsor or people that would support it and write letters of support. So we're at this point in time, that's, you know, we need to get it, the wording final and the definition final, but then we can go out and
Even without having it finalized, I know that's something that we spoke about during our committee meeting with our lobbyists, saying that they're already we asked or give them some sort of direction to start looking for other stakeholders throughout the state that would actually be in support of this. And then also identifying who would be in opposition so that we can get in front of them ahead of time before it's, you know, too far out in the process.
So I've asked our lobbyists to provide us a draft letter form. So maybe we can circulate that to the Desert Care Network folks and Eisenhower, et cetera.
The letter's super easy to submit. You can just submit online. So it's not something that we actually have to like. Of course, we are gonna track them and make sure that they submit it, but those individuals that wanna submit or be in favor of this or support it, they'll be able to submit their support directly through our website.
So is that something that we can help with on our side to do a little marketing outreach? Is that what our lobbyists do? Is that something that we as a healthcare district, if we find that we're in support of it, is that something that we can begin helping get the word out about this?
Yeah.
To submit support, you know, because
Yeah, I think we can do that. We can probably send through like some blasts and, you know, contact our, you know, healthcare partners and that, and then I can probably learn from our lobbyists that, because you were talking about submitting online. So I don't know if you know specifically how to do that. Maybe you could share that information and then we can send that out to our partners as well.
would our media partners be interested in helping too? I mean, I know we have connections with the Desert Sun and some of the news, just a simple thing to run and say, hey, this is what's going on. Here's what's being said about it. If you're interested in supporting it, go to this website, click on this, show your support, because I think that would go a long way to show you have big support. And then there are some healthcare groups, both nurses, I know physician groups in Riverside County that we could get their support as well. before you go to like a, you know, a more of a statewide support level, I think we could get our community organizations to probably support that. So not just the hospitals, but actually the physician and nursing groups and healthcare provider groups would be happy to probably support it.
Yeah, we may even be able to, I'm sorry, Director Pilar, but we may be even able to get, you know, some of the news channels as well to provide some communication that are following us as well. So.
What we can do, and I guess this is more on the preference and how we want to communicate it to the public, we can update the public as the bill goes through, like whenever it's gonna be heard on committee. Once we have that date, we can publish it. Look, the district is the sponsor of this bill. You'd like to submit it. If you want to listen to the hearing, we can include the link to where the hearing is live streamed, and then also how we can submit the support. And then, you know, crossing our fingers, we'll make it all the way through, and we can update the community as, you know, the milestones of the bill.
Yeah.
So, thank you for recognizing me. Okay, so I was just wondering about ACHD. How long will it take before you find out whether you will be appointed to the board of directors?
I think the application deadline is April 4th. So I imagine not long after that, depending on how many applicants they have.
And I do agree with Director Logsdon that it is important to get public support, but I think it's more important to get general support from other entities throughout the state to demonstrate that this is, even though it's a local interest that's bringing it forward, that there's not going to be negative statewide. So ACH is definitely one of the.
Yeah, and actually our lobbyists are Sarah Bridge, who works with us on the lobbyist side, is also employed with ACHD. So they will be seeking support letters from there as well.
I do know that the Greater Coachella Valley Chamber of Commerce has received information and voted to support it. So that'll be our first group that has come on board with us.
So the next item is 1C, AB 2019 Healthcare District within the committee. And actually I have a question before it's decided. So you want me to go through all these items? They're also included within the minutes. You want to watch them?
You know, we listed them, but you're right. They are all identified in the minutes. So I don't know that you need to go into detail on them. Maybe just each one, ask if there's any comments or questions.
About any of them?
All right. Item 1C, AB 2019 Healthcare Districts. Any questions on that? Or
We let the board have first, but
so we asked our lobbyist to connect with Aguirre Curry's office to determine if she is open to listening to us and our concerns. And then they're also going to ask other clients of them to see if they're having any issues with this this policy. And if they are, then we're going to try to connect with her office, the assembly member's office, and then determine if it's something that she'd be willing to amend or introduce next year. If not, then if it's our desire to maybe look for a different author, we do want to move it forward. Okay. So do you want to add?
yeah, I just wanted to say that this is an issue, the restrictions on the solicitation, and it has been an issue at Grossmont also. And I think there may be some interest that district would also be interested in working. They have their own lobbyists, but they have a legislative committee just like this committee, which I think is great that you guys are jumping in, especially with the background that some of the directors have. But I think it's might be worthwhile. I realize it's not happening this year, but you want to try to build, and maybe there's some other districts that you could identify that have the similar concerns, because we're trying to comply with this statute, but at the same time, it does have a chilling effect on the ability to do outreach.
Because yeah, let's connect with them and see if we can get a meeting with assembly member's office and see it might be something that she's very interested in, and you never know.
Yeah.
Legislators always have spot bills available, just park there for like last minute things.
So our lobbyist is working on creating some communications and dialogue that might move this forward.
Thank you. So item one, H1D, Legislative Policy Committee goals and objectives. Any questions? Okay. Any questions on the next 6 items? Just kidding. The rest of the item.
One thing I didn't see mentioned, there was the assembly bill we talked about that was talking about us getting together and how we handle meetings. Was that reviewed at all at this?
Well, you could, yeah, we can
I
certainly.
can't remember, I was trying to find the assembly bill, I'm sorry, it just like.
On the Brown Act? or-
Yeah, the Brown Act, but it
or
talked about how
oh,
we
I
handle
know which-
meetings.
Is it the virtual? Being able to-
Yeah, yep. I don't know if that was, I didn't see that in the agenda.
no, we did not discuss that bill.
Alright, is it-
I don't
It's
know.
only extending the time period. right?
Yeah, it really doesn't change anything substantively. It's really just making sure that the existing law is extended, because I think it sunsets in 2026.
Right, so they're gonna push that.
Yeah.
All right. No questions? We're good. Thank you.
Any other questions? Any comments from the community, public, those present? Moving on, Finance, Legal, Administration, Real Estate Committee. Dr. Logston.
Sure.
Dr. Logston, would you like to make a report?
I think the agenda's there, the meeting minutes are there. Are there any questions regarding what we discussed at that?
No comments, no questions? All right, Program Committee. President Yvette Perez Gill is the chair. Phoebe Greg.
I was in Austria.
Oh, that's true.
I'll go.
Okay.
So you weren't at the meeting?
No.
So, item 3A, draft meeting, minutes. Any questions on that? Any questions on the progress and final reports update? On the grant application status report? Any questions on the grant payment schedule? And then we do have an action item. So it's a recommendation based on legal counsel to postpone proceeding with grant number 1466 for Eisenhower Health in the amount of $1,989,493 over 3 years.
And the reason for that is?
So we can have.
Yeah, would you?
Yeah, okay, the memo is in the file there if you want to take a look at it, but basically, as you all know, Eisenhower recently filed a lawsuit against the district over this, primarily over the covenant not to compete in the validation action that we brought. And for whatever reasons, Eisenhower challenged the language. They basically challenged the language in the 1997 lease and brought that in, which is the subject of the grant application that's been pending for some time now. And, it specifically mentions the grant application in the lawsuit. And I think that, really, it's in the best interest of the district to wait until we get a ruling from the court, because the court may decide that there is no violation, or the court may decide that that application would be a violation, this pending grant. So it just doesn't make any sense. It's sort of like, it doesn't make any sense for us that we should be processing something that's involved in litigation. And so we're best served just to wait and let the courts sort of sort it out. And then if it turns out that the grant's valid, or it's okay, it's not a violation of the covenant not to compete, you can proceed with it. But it's sort of a cloud overhanging this. It turns out if it is in fact the covenant not to compete is valid, then this could very well be a violation of that. So it's kind of, we'll just still wait and see.
Discussion, Dr. Logston.
I have one question. And this was triggered by the inclusion of this grant in the actual litigation matter coming out of the Eisenhower Group. Is that what I was trying to understand exactly what you said? They meant the grant in the.
Yeah, it's kind of complicated, but we have had a lease that was we entered into in 1997.
Yeah.
And during that time, we've actually given Eisenhower $1 million,
Yeah.
okay? But they brought forward this new grant, and it, as you know, it has money that's going for staff and everything like that. So when I looked at it, I had legal concerns that I shared with the committee and board about whether or not it was a violation of the 1997 lease. So separate.
Sorry, but I need to ask this question, so I need
Yeah.
to interrupt. Is it okay for Director Logston to be participating in this discussion, considering that he is employed by Eisenhower?
Well, I think he serves on the medical staff, right?
Okay, I just wanted to
Yeah,
clarify.
I mean, at
For the record.
this point, I mean, we'll talk about that a little bit. This is a public meeting, so
Okay,
he
Thank
can,
you.
he can ask the
We're
questions.
not voting
I'm
on
happy to
it.
answer.
Yes,
we
questions.
will be voting.
Oh, that's fine, then I can.
Okay, and so, yeah, until we clarify exactly what your contractual relationship is.
Yeah, that's
probably,
I would prefer that.
yeah, and so
We're interested in the
you may want to
context.
just to basically excuse yourself
Of course.
from the proceedings. But in any event, that's the 97 situation. And then what we really heard about over the last year was the concerns that were raised with respect to the provision in the proposed 2027 lease, which was in fact overwhelmingly approved by the voters. And so they brought that action, but for some reason, I don't know why, they had to insert this other issue from the 97 lease. So at that point, from my perspective, it serves no purpose for us to be proceeding with something that's involved in
It
litigation.
sounds like it's kind of confounded the whole situation. It's kind of.
Yeah, it really
It
compounded.
kind of, it really compounded and kind of
Yeah,
intermingled.
and
I didn't understand that.
you know, my advice to my client is to basically suspend this.
Yeah.
And let's see what the court says. And then if it turns out that it's okay, we can always bring back something like this. So I think it's better for you to abstain
100%.
and maybe excuse yourself. So that'd be my recommendation.
We have, is there, me?
Go ahead.
Is there a time frame that we can hold on to our grants? Like, are we supposed to give him a resolution within a certain?
I think if you take the action to just simply suspend it, that's all you have to do at this point. And then depending upon, there may be a settlement, who knows, if there may be an outcome.
I just want to make sure that we're not contradicting any of our own internal policies, and if that was the case, maybe instead of postponing it, we
This is,
cancel it.
this is a unique situation.
So my question is there anything in the grant or communications that our CEO has had with Eisenhower to indicate that there is an urgency for us to act on this sooner rather than later?
Well, there's been conversation about, and obviously Eisenhower is desiring an action either for or against. But I think as legal counsel is directing us, is that, it's better not to make an actual decision to decline right now, because if we do decline, and if there's more to it that says that, okay, we shouldn't have, then that potentially puts us into some issues. So the guidance for us to postpone it versus decline seems to make sense until we get through the actual litigation process.
And the other
The reason
part,
that I ask this is because I do think that it's important to have some certainty when there's services that could be impacted. Are they hiring people? Do they have an offer out there to somebody and waiting to find out if they get the funding or not?
Okay.
So that was
my point, was that my understanding is they're moving ahead with this.
They
And so there may
are.
be some other opportunities down the road.
Okay.
But rest assured, this is happening. The district's funding is not going to inhibit this.
We went to, last week, you were there, and Dr. Carter mentioned that the residency program did get credited. So that's to Jeff's point, they are moving forward.
Thank you.
Any other discussion? Any discussion from the public?
None.
Any discussion from those present? Do I have a motion to approve?
I move approval.
Second.
Roll call, please.
Director Shore,
Yes.
Director Delara,
Yes.
Secretary Baraza,
Yes.
Vice President Rodriguez.
Yes.
President Rogers.
Yes. And Dr. Watson wanted to abstain.
He has, we should let him know that we're back.
Yeah, he recused himself for the record.
For the record.
Can we let him know?
I know, I gotta talk to him, yeah.
At this time, we have board member comments. Do we have any board member comments? The only comment that I had was looking back at my report from the Board of Governors for the Desert Region Medical Center is that my and the chief medical officer gave a report about this physician shortage. And in California, it was determined that there was going to be close to 24,000 physicians shortage in California by the year 2030. And I also wanted to point out that Las Palmas Medical Plaza is 100% occupied. There's no room for new doctors. So I'm hoping that at some point in time in our planning, future planning, that we consider looking at a medical office building. I know that my term for 8 years in the Bay Area and that district, we built 2 medical office buildings, beautiful ones. All we had to do was get a bond and they were ready. I just want to plant that seed in your mind. We'll have adjournment. Anybody move to adjourn?
Motion.
Second? All in favor, say aye.
Aye.
Right.
Aye, okay, shall we have a 5-minute break or shall we move on?
5 minutes.
Okay.